An estimated 15 million adults in the U.S. have a serious mental illness. That's according to the National Institute of Mental Health. Kentucky mimics the national average, although research suggests many Kentuckians are undiagnosed. How we treat and care for these individuals is the topic of a recent episode of Kentucky Health. More about it in tonight's medical news.
We're not a rich state, and I'm not saying that rich versus poor is going to influence us, but being that we're on the lower end of the economic scale, do you tend to find it more of a problem in lower income groups or at states?
Mental distress, sure, because many of those psychosocial stressors contribute to mental distress. Yes. So lack of adequate food, inability to take your family members to the doctor, have transportation, school, any of those resources can certainly exacerbate vulnerability to mental distress. Substance use is another one of those. Kentucky has very high rates of substance use, and that can exacerbate what might have been baseline symptoms, but can then turn into a more serious mental illness.
You see the same thing?
Yeah, absolutely. I mean, I think interestingly enough, we talk about SMI, and 4 to 6% is sort of the
serious mental illness. SMI.
Yep. And so, but what is interesting is that in our jails and prisons, and I think that was in your teaser, we see a much higher rate of SMI amongst that population. We see anywhere from 15 to 30%, and so you're talking about a significant number of people that are there. And ironically enough, there are more people with SMI in our prisons and jails than are actually in our state hospitals. So that's kind of that's more of a national sort of thing, but a lot of states have kind of done away with their state hospitals and whatnot. But yeah, there's more people with an SMI in prisons than there are in state hospitals. The other piece I think that's super important to appreciate is that, why is that a problem? Well, that's a problem because people aren't being treated. There's very few to very little resources provided to jails and prisons for the treatment of mental illness. Now, there's a lot going on, but it's very, very much under-resourced, and it's not even coordinated oftentimes. It's not uncommon to hear stories at the state hospital where we work, where patients have come to us and they've been in the jail system for several months even, and we get them and they are just absolutely, they're in significant crisis, very unstable, and they've been that way for several months, not receiving treatments.
One solution is UK Healthcare's new Empath unit. It's an emergency room for those experiencing mental illness and behavioral health problems. The unit on the campus of Eastern State Hospital is the first of its kind in Kentucky. You can learn more about its mission and see the full episode of Kentucky Health with Dr. Wayne Tuckson online and on demand at KET.org.